I'm Dawn Buse. I'm a licensed clinical psychologist and researcher, and I work in the field of headache and pain. I'm an associate professor of neurology at the Albert Einstein College of Medicine in the Bronx, and I also work at the Montefiore Headache Center. If you've ever heard that 11 or 12% of people in the world have migraine, that comes from our AMPP study. If you recently read about the burden of migraine to the whole family, that's something we recently studied in the Cameo study. And these studies are so important because we survey people all around the world who live with migraine, and we get to hear their stories and their responses and collect data directly through them. And by doing this, we really get to learn about how migraine affects the individual, how it affects their family, and how it affects their whole life. So these studies have given us a really important insight into what life is like living with migraine. We know that migraine can affect every aspect of someone's life. That can include work or school, it can include leisure, social activities, it includes families. So it includes activities as a spouse or as a parent. We know that migraine takes away whole days or weeks or months of someone's life, and they often feel like this disease has taken over their life. In many cases, we hear that people miss out on family events, personal events, important events at work. And we call that absenteeism. We also have this concept about presenteeism. So maybe the person is there, but they're not really able to participate. They're not able to enjoy an event. Maybe they have to come late or leave early. Or maybe they can't be part of the family holiday celebration because the noise or the lights are too much, or their head is hurting too bad and they have to excuse themselves and go lay down in a dark, quiet space on their own for a few hours. So we hear from a lot of people that migraine really takes away important and major parts of their life, which can lead to a lot of feelings of frustration, sadness, anger, and sometimes helplessness and hopelessness. So some things that are really important to think about is there are a whole range of effective treatments which can really help migraine. And there are acute treatments, which are treatments you take when pain is happening, when a headache is starting, when an attack is starting. And there's preventive treatments, which may be treatments that you do preventively on a daily basis or on a scheduled basis. And not all treatments are medicine. There's also non-pharmacologic treatments with very good evidence. I myself am a licensed clinical psychologist. I see patients at the Montefiore Headache Center, and we do biofeedback, cognitive behavioral therapy, and relaxation strategies like guided visual imagery, meditation. And we know from the science that these treatments can be really helpful in managing the number of headache days, but also managing how migraine affects someone's life. Some things to remember to stay more hopeful are that not only are new treatments, pharmacologic treatments, coming our way, and existing treatments that people may have not tried yet may be very helpful. There's a whole range of safe and effective treatments, but there are also all these things someone can do themselves that can really make a big difference. We want to think about lifestyle factors. So getting enough sleep, having a regular sleep schedule can help. We definitely want to think about managing stress to the best of our ability. And we can't always control what happens to us. We can't always control what's going on in the world, but we can control how we react to it. And that's what we talk about a lot in cognitive behavioral therapy, is changing our ways of reacting, changing our thoughts to hopefully calm our nervous system and reduce our experience of stress. So managing stress is very, very helpful. Literally, it's important to remember that you are not alone. In fact, 1 billion people on the planet live with migraine. And that's more than 36 million people in the United States who live with migraine. That's 1 in 4 households having someone who lives with migraine. So to combat those feelings of isolation, depression, frustration, loneliness, it's important to reach out. There are so many ways to do that. One is talking to friends and family about your experience, what you go through, what it's like. Let them know how they can help you, because friends and family want to help you. They just don't know what to do. The more you start to reach out, whether online or in person, and the more connected you feel, the less you might feel depressed, frustrated, and isolated.